What's up, everybody? This is Justin Flinner coming to you live from Northern Virginia with the Justin Flinner Podcast by My Metro Medicine. Before I get into this week's podcast, I want to inform you all of a very important addition to our podcast, and that is on our main platform. You might be listening to us right now on Spotify or Google Play or Apple Podcasts or Amazon Alexa or TuneIn Radio. It doesn't matter what platform you are listening to us on. The main platform where our podcast exists is Anchor. That's where we put all of our information, and then it gets dispersed onto all of these other platforms. On Anchor, you now have the ability to share with us your gratitude. You can share with us your appreciation for all of the content we're putting out. You can help us to build and explode into an even bigger podcast than we already are right now. You can contribute to the development of the Justin Flinner Podcast, and you can do it right here. You can do it right now. As soon as this week's podcast starts, you can go directly to our website, www.mymetromedicine.com. Find the Podcasts and Media tab, and under that tab, you will find the Anchor platform. If you're already listening to us on Anchor, you can go right to the button that will allow you to contribute to our podcast. By doing so, we will make sure that we put every single dollar devoted to this podcast towards the development of the quality, towards the enhancement of the quantity, and you can even recommend topics. You can tell us, hey, I want to learn a little bit more about this. We'll do the research. We'll find the expert. We might even bring them onto the podcast, and we'll have all of that information available for you. Just throw a few dollars in there. We'll do the work. We'll put in the time because we know that you're listening, and we are listening to you. And above all, I want to thank you for your time and for your listening. You wouldn't be here if you didn't find value in what it is that we were producing for you on this podcast. So thank you. And now for this week's podcast. This week's podcast is a message that goes out to all of the healthcare practitioners in the world. In a class I was teaching today, we were talking about the different methods of diagnosis. Patient comes in, you analyze what they say, you analyze the actions that they perform, you take a look at the information they provide you, whether it's on a sheet or whether it's in person, you make your analysis, form your diagnosis, and then create a treatment plan that will ultimately help the patient get better. Essentially, every practitioner of medicine will perform this in some way, shape, or form. In Oriental medicine, we use the process of 4 inspections. We ask questions, we observe, we listen, and we feel. We use these methods to help understand what it is that the patient is experiencing, to help get a little better understanding as to how we can help this individual, why it is that they are there, what other things might come up, and where can we go from here to make sure that they don't get any worse than they already are. So imagine you're a patient coming into my clinic. You come to see me for a specific reason, whether it's joint pain, whether it's a stomach ache, whether it's a much more serious problem. Regardless of what it is that you come in with, I'm going to utilize these 4 methods to help understand what it is that you are experiencing. I'm going to ask you a whole bunch of questions. I'm going to observe not only how you respond to those questions, but I'm going to observe how you sit in the chair, how you walk into the room, how you lie on the table. I'm going to be observing all kinds of different things from all kinds of different angles. I'm going to be listening to not only the words you say, but I'm going to be listening to maybe your tummy is growling. Maybe there's a particular sound in your voice. There could be various things that I'm going to listen to throughout the process of the appointment. The last thing that I will do is I will actually feel. So I'm going to feel on areas of the body. So I'm going to press on certain points, see what kind of reaction you have. If you come in for a specific reason, such as maybe you have issues in one particular joint, then we'll utilize certain movements, certain tests to see what might actually be going on with that joint and analyze what it is that we can do, all through the process of feeling and asking questions along the way. Now, I take that information, I apply it to what I know, and try to figure out, okay, what is it that we can do with all of this information, and where can we go from here? What sort of things are showing up? What sort of things aren't showing up that should be showing up? And how can we treat this? What actions can I take to make this person leave feeling better than when they came in? There is one thing, though, that I never do. And that's the reason this message is directed towards healthcare practitioners, is because the one thing I never do is I never, ever assume that I know more than the patient. The moment a healthcare practitioner decides what the patient knows is not enough is the moment that we have failed. We have taken the patient completely out of the equation, and we have said that, you know what, you don't know anything. You come to see me, I'm the professional, you're paying me for my knowledge, you're paying me for my expertise, so just shut up and listen. Ultimately, that's the message we are delivering. It has been conditioned into the minds of all patients because what do? Well, we routinely show up every year or on a regular basis if we're really concerned about our health. We routinely show up saying, what is wrong with me, if anything? Please tell me and tell me what I can do about it. I rarely meet an individual who comes in and tells me, well, I know exactly what I need to do with my health in order to make myself feel better. However, I run into a little bit of a roadblock, and these things aren't working at the moment, so I need your help. I need your guidance. If I had patients like that came in every single day, it would be glorious. That would be fantastic because the patient already knows what it is that's going on inside of their body. They can explain it to me in a way that someone who doesn't know what's going on inside of their body can't. The closest that I can get to understanding what a patient is going through is through a couple different methods. I can actually try to embody what it is that they're experiencing. So if they have an issue with a joint, for example, that causes them pain when they walk, I could try to mimic how they walk while they're experiencing the pain. I can see, okay, if I walk in this interesting way, I notice that these particular muscles of my body start to get tight. So embodying what the patient is going through is one particular way. Another particular way is to observe it through multiple lenses. So I have all kinds of different ways to diagnose. I can use different theories such as yin-yang. I can use the 5 elements. I can use what's called the 8 principles. I can use all kinds of different lenses to diagnose what it is that is actually going on inside of a patient. It doesn't mean that every single one of them is going to give me a good answer. What resonates most with the patient is going to help me determine which lens, which pair of glasses I need to put on my eyes of diagnosis. In order to understand, though, what the patient is going through, the best way for me to get to the root of what's happening is to shut up and listen. I need to listen to what it is the patient is saying, and I need to listen to what the patient isn't saying. It's in the information that patients don't provide you where the answer ultimately lies. So when a patient comes to see you, it does not matter what healthcare profession you are skilled in. It does not matter what you practice. It does not matter how you practice. The most important thing that you must remember is that you do not know the patient's body better than they know it themselves. Even if they have forgotten along the way what it is they're experiencing and why, it is our job to make sure that we can guide them back to knowing why. When you can tell the person, okay, it seems as though your body is moving this way. What was it like before it moved this way? Can you tell me? Right there. You already are proving that you don't have enough knowledge and you're trying to gain that from the other person. Through the process of reminding the patient as to how their body was before illness, reminds them of what their body will be like after illness and how to get there. How you get to illness is how you get out of illness. You stub your toe, well, you learn that I'm not going to stub my toe anymore. The stove is hot, you put your hand on it, you scream, you realize, wow, that's hot. I probably shouldn't put my hand there anymore. And that's a simple explanation, but health really can be that simple. When we analyze the human body, it will tell us exactly what it needs. It will tell us exactly what it doesn't need. We condition our bodies just as we condition our minds, just as we condition our ways of life. There's a very old saying in martial arts, you must know yourself before you can know your opponent. The moment you understand who you are as an individual and the fact that you have a lot to learn will remind you that, okay, this opponent, or in this case, the patient has a lot to teach me. If I can understand my body, then I know that I can learn to understand every patient's body. So the next time, all of you healthcare practitioners out there, get into the treatment room and start to think and let your train of thought go way off, away from the treatment room, around the corner, and back into all of your textbooks. The moment you get back into that way of thinking as to, okay, this person's got a problem in, say, their liver meridian, or this person's got a problem in their cardiovascular system, or this person's got a problem with the way they approach life emotionally. Therefore, my conclusion is the patient has disease A. Okay, what about when the patient was talking 5 minutes ago before you left the room mentally? The most important learning experience of your healthcare profession is the moment you're sitting there face to face with your patient. And the best that we can do is to shut up and listen to what the patient has to say. I don't care how much limited time you have as a doctor. I don't care how much limited time you make for yourself to move from room to room. I don't care how full your clinic is. Every single patient deserves all of your attention, not some of it, not a small piece of it. They deserve every single part of what it is that you do. And the number one thing that they deserve from you is your listening. That is the least that you can provide. And the next place you go with all of the information your patient provides you is definitely not into judgment. Judging the patient by saying, well, if you just move your body a little bit more and lose some of that weight, you wouldn't have all of these health problems right now. Maybe you wouldn't have become a diabetic. Reality may be reality, but your reality is very different from your patient's reality. The experience that they have through what it is that they are going through is not what you envision it to be in your mind. You can disagree with me all you want. You can say, well, our knowledge is on a much higher level than what the patients have, so they pay money to come and see us so that we can essentially save their lives before something bad happens. Perhaps that's one way of looking at it, but the moment you add humility to your skill set is the moment your patients will begin to respect you more. Your level of rapport will go through the freaking roof. And once a patient can see that, wow, this person does actually listen to me. They want to listen. And we've been talking for almost 30 minutes now, if you have the time, right? So we should spare the time. The number one thing we should give the patient is our listening. The number two thing is that we should give them is our time. Now, I'm going to save this for another podcast, but it's also what we are listening to, what it is that we choose to focus on, what it is that we choose to talk about. Do you always focus on the negative? Do you always focus on, okay, what's wrong with you today? What brought you in here today? Oh, you have pain. Tell me about the pain. We always ask about the problem, the issue, the condition, the disorder, the disease. What about all of the other things in the patient's life? We, healthcare practitioners, do not know as much as our patients do. They will know way more than we ever will about their own bodies. So I urge all of you healthcare practitioners out there to re-examine your examination rooms, to re-examine how you examine your patients. What is the first thing you talk about? How much time do you devote to the patient's appointment? And how is your quality of listening? And one final point. The fact that the healthcare industry is consuming so much of this country's money is a sign that we are doing something wrong. We are not living up to the standards that we went to school for. We are not actually helping people with the same capacity that we had going into school, with the same level of passion, the same level of interest. We are failing the healthcare industry. We are failing our patients by not reducing these numbers, by not reducing the number of diseases. We constantly, every time a new volume, and I say volume because the book is huge, the classification of diseases grows every time a new volume comes out. We are creating disease. We are creating new versions of diseases. The fact that we cannot reduce this book, reduce the number of classifications of diseases, is a sign that we are moving in the wrong direction. So healthcare practitioners, acupuncturists, medical doctors, physical therapists, all of you out there who have a profession that is dedicated to helping the health of individuals, remember, you know nothing when it comes to your patients. You have gone back to school, and they are your teachers. This is Justin Flinner, and I'm coming to you live from Northern Virginia with the Justin Flinner Podcast by My Mentor Medicine. I thank you all for listening, and all of you healthcare practitioners out there, please, please, please put these words into action. Show your patients that you are ready to listen, and that you are, in fact, ready to do something with them, not to them. And patients, potential patients, if you are, in fact, suffering from some form of pain, be it physical, be it emotional, give us a call, 202-505-2805. You can find us in downtown Washington, D.C., and you can also find us in Virginia. We'll come to your home. We'll come to where you are. We'll make it as easy as we possibly can. We're here to help. And above all, we are here to listen. Thanks again for listening, and I'll see you back here next week. This podcast is brought to you by My Mentor Medicine, an organization that is dedicated to helping people improve their lives by learning to empower themselves and take control of their own life. Any form of reproduction or distribution of this podcast is strictly prohibited. Should you have any questions on using this podcast or information that is contained within this podcast, please write to info@mymentormedicine.com.